what to check for and how to choose the right Medicare Advantage plan. If you are turning 65 and you're considering Medicare Advantage, I believe that you will find this helpful. If you are past 65 and either already have Medicare Advantage or you're considering it at some point in time, I think you will find this helpful as well. Hi, I'm Chris Prang, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in other states as well, which you will see at the end of this video. If today is your birthday, then happy birthday to you. Catherine Pulsifier said, don't regret another birthday. The good news is that you are alive and you can celebrate it. So if today's your birthday, then by all means, celebrate your birthday. So what to check for and how to choose the right Medicare Advantage plan. The first place I start is with prescription coverage, regardless of whether or not you are currently on medication. So you want to get the right prescription coverage unless you have VA benefits, that's Veterans Administrative Benefits, and you want to do this because you avoid penalties later. If you don't get Part D when you first get Part A, then you will be penalized for it later. And so you want to avoid that if you get Part D later. And the other thing is, if you don't get Part D when you're first eligible, you think you don't take any medications or they're all cheap, what's the point in paying for a drug plan? I get it, sort of makes sense. But it's 3 years down the road, it's the middle of the year, and your doctor prescribes you a very expensive medication that's $500 a month, $1,000 a month, or potentially even higher than that. In most cases, you can't run out in the middle of the year and pick up a Part D drug plan. You have to wait to the annual election period, and then that won't start to January 1st. So you literally could go months of having to pay high costs for prescription coverage. That is why I typically advise people to get Part D regardless. The other thing you want to do is then compare your prescription coverage. I help with this when you are initially rolling into Medicare and during the annual election period. I have found after 13 years and thousands of people, most people do not check year in, year out. Now, if you're on inexpensive, generic medication and you're not paying a whole lot for them, and they're typically tier 1 and tier 2, and that's what you're staying on, typically you don't have to be too concerned from year to year. But if you are on brand name drugs and you're on specialty drugs, then you want to do your due diligence and check every year to make sure that your Part D coverage is acceptable, meaning you are not paying more than you should be paying. There's not another plan out there that will save you money. The next thing we want to check on are the provider networks. So when you are in Medicare Advantage, you are typically going to be either in an HMO or a PPO, maybe a private fee-for-service, but typically HMOs and PPOs, and both of those have provider networks. So you always want to make sure that all of your doctors are in the network. And if you find one that isn't, at least you know that that doctor is not in the network and whether you can go to them or not, or if you're going to pay more or not by going to that doctor. So ideally, you want to go with a plan or a company that offers the largest, most flexible, and stable network. One thing people don't tell you when it comes to Medicare Advantage and provider networks, the providers, even though the plans are annual plans, January 1st to December 31st, providers can come and go any time of year. I don't like that rule. I think it should be changed. Because if you're going in and you're choosing a plan because your provider's in the network and all of a sudden it's May and the provider's out, then you're stuck. You can't go to that provider or you got to pay more. That's a rule that I wish they would change. Next, you want to make sure your providers of choice are in the network. If they are not, then you may not be covered or you will pay more. In addition, for provider networks, you want to make sure that your state's or region's go-to teaching hospital is in network. These are usually tied to universities. Whether you go there or not now doesn't matter. It matters if you will need access to them, and you want to make sure that you will have access to them, ideally as being in network. Then, do you need access to a specialty hospital? If so, then make sure they are either in network or that your plan offers what's called a passive network. That means you pay the same price in or out of network regardless, not paying more if it is out of network, and they are willing to bill the plan. If not, my advice is to get a Medicare supplement unless you happen to be on Medicaid. The next thing you want to check for is the MOOP, the maximum out of pocket. This is what you potentially pay for in copayments for any Part A and Part B expense, also including deductible. Ideally, you want to choose a plan with the lowest maximum out of pocket. Just because one plan has lower copayments doesn't mean you won't pay more out of pocket. You must understand your financial risk exposure. The next thing you need to know about is dealing with potential prior authorizations, benefit limits, exclusions, and declines. Understand what they are and how they compare to original Medicare. Original Medicare does require prior authorizations in some cases, but Medicare Advantage typically requires them more. See my video on comparing customer satisfaction between Medicare Advantage and Medicare supplements for more information. Next, you want to compare the extra benefits, the bells and whistles. I believe this is the last thing that you should be concerned about. Unfortunately, all the advertising focuses on all the extra benefits, the bells and whistles, and people go, oh, do I get this? Do I get that? You know, have I got my grocery card and things like that? So that's not why you choose a Medicare Advantage plan. Let's take a look at what Medicare says. If you look at your Medicare in U-Book, you will see that when it talks about Medicare Advantage, some of the extra benefits could include things like fitness programs, vision, hearing, and dental services. Plans can also choose to cover even more benefits. For example, some plans may offer coverage for services like transportation to doctor visits, over-the-counter drugs that Part D doesn't cover, and services that promote your health and wellness. As I've mentioned before, never pick a plan based on the extra benefits. Find out how they work. Next, you want to ask yourself, am I a good candidate for a Medicare Advantage plan? Some people are, and some people aren't. And you need to determine whether you are or you aren't. If you are non-Medicaid, here's what you need to ask yourself. Are you in relatively good health and maintain your health? Will you be okay if you suddenly have a health issue that requires you to potentially pay thousands of dollars out of pocket? Can you deal with the occasional prior authorization or benefit limits? Would the extra benefits be of value to you and outweigh any potential out-of-pocket costs? Do you need access to a specialty hospital or out-of-network specialists? Would you prefer more managed care or value-based care? So when you get to Medicare Advantage, because it is done by an insurance company and not Medicare, it is more hands-on. It is more managed care. You're going to get phone calls reminding you to do your preventative services. You may have nurses or clinical care advisors checking in on you if you have chronic conditions. Are you okay with some risk for potential greater reward when it comes to cost savings over time, possible better health care outcomes, etc.? Okay, what about if you are dual eligible and considering Medicare Advantage? So dual eligible means you qualify for both Medicaid and Medicare. Do you have full Medicaid benefits? Extra benefits could be very helpful, if so, more managed care or value-based care, and you can opt out every quarter if you don't like it. So that's it for today. That's pretty simple. That's how to pick and choose the right Medicare Advantage plan for you. I hope that you have found that helpful. If you have questions, if you need help, and you're from one of the states that I'm licensed in, please reach out to me. I'd be more than happy to help you. You can see my contact information there. You will also see a couple contact pages on there where you can reach out to me as well. The states that I'm currently licensed in, this does change. So please check the description of my Medicare channel, the About section of my Medicare channel, to get an update, or go to my website to get an update on the states that I am licensed in. But currently, I am licensed in Virginia, Florida, North Carolina, South Carolina, Tennessee, and Texas, with other states coming soon. Do you live near the Charlottesville, Virginia area within about an hour or so, and you would like to meet in person, which is a great way to meet? Please reach out to me and we can probably work that out to meet at a safe and convenient location for you. As a reminder, please like, subscribe, and who do you know that can benefit from this information? And if you don't mind, in the comment section below, please let me know what state that you're watching from. That does help me out. I'm Chris Prang, the Medicare analyst. Thanks a lot, and make it a really great day.